So, good morning, everyone. Our chosen topic is about community assessment. The title is The Nurses' Mental Health During the COVID-19 Pandemic. We are the Team King. I am Richmond Valledo.
I'm Kathryn Jinky Fangon.
I am Marneli Lim.
And I am Froilan Imatong. To start our presentation, the group decided to name and define the community we are evaluating and the parameters of our chosen community. So the community is made up of Canadian nurses who are working in the midst of COVID-19 pandemic, and the parameters are the stress of the pandemic is causing mental health issues in the community of nurses in Canada, and the community of nurses in Canada requires aid in dealing with mental health issues. So why did we choose this community as the focus of our assessment? So the focus is the mental health of the mental health of nurses in Canada because nursing is demanding job under the best circumstances, but with the global pandemic that has turned many healthcare facilities into battlefields and killed more people in Canada alone, the challenge and demand are insufficient. As an outcome, we have been inspired by this healthcare sector because we believe mental health is an important issue, especially in a tough environment during a pandemic. So nurses in Canada most often shared strong feelings with their work colleagues, which has been connected to a rise outgrowths of mental health issues, especially the continuing pandemic. And nursing is a tough job, and many nurses in Canada have been experienced immense stress, tiredness, and emotional trauma. As a direct result of this emotionally and mentally demanding patient care environments, they face daily hostility, burnouts, and deaths of patients and healthcare professionals. As a result, daily threats of their own personal well-being and safety as their workloads increase and working hours lengthen.
The kind of assessment on nurses' mental health we need in order to meet the needs for the future development of a community is by conducting a needs analysis to identify the nursing positions that would be needed for the future political or community development. In here, we could utilize using surveys, interviews, and focus groups to accomplish this. Once their needs are acknowledged, we can next create a plan to address them. To develop a plan, we may include advocacy activities and educational initiatives. What's going on is that as a result of COVID-19, the mental health of nurses have been deteriorating. Anxiety, worry, physically and mentally burnout are common feelings among nurses. With all these experiences, some nurses suffer from PTSD. We identified community strengths and challenges. The strengths are number 1, resilience, and 2, the ability to adapt change. The community has strong support system, which helps to offset some of the challenges that nurses face. These challenges includes mental health issues such as anxiety and depression, lack of educational trainings, and the community also has a limited number of resources available to support nurses' mental health. There are many organizations and services available in this community for nurses' mental health support. Some of these include: 1 is the Ontario's COVID-19 Mental Health Network. In here, clinical services to support health care providers experiencing distress. Number 2, coping with stress and anxiety for healthcare workers. In this site, it provides information and suggestions about how best to cope with stress and anxiety. 3, support for mental health and well-being. This supports the overall well-being of nurses' mental health. And last, counseling and support groups online. There are different online support groups like the www.connectsontario.ca and www.smartrecovery.org.
Who are the gatekeepers? They are the leaders and administrators of nursing organizations. In addition to those who create and implement health policy, are the ones who can help open the doors to help enable big improvements in the psychological health of nurses. In order to communicate successfully with all these gatekeepers, it's indeed crucial to be brief and clear about the program at hand, as well as to offer them evidence-based suggestions on how they might support nurses' mental health at this difficult time. How about the stakeholders? The patients that nurses care for, as well as their families, are additional stakeholders. The issues that nurses are encountering must be discussed openly and honestly with these stakeholders in order to share information and tools that can aid nurses in managing the tension of the situation. What are the ideas and voices that are not heard? Several of these voices could be those of nurses who are currently experiencing mental health issues. At the same time, there is an imbalance in the amount of attention provided to nurses due to their impaired social position and unequal power distribution within the healthcare system. And others can come from those who aren't in the medical industry but are nonetheless impacted by the pandemic. Now, let us talk about who are experiencing or who are included in the community assessment process. When performing community assessment, it's crucial to involve everyone in the area, especially those people who are vulnerable, marginalized, or socially excluded. That is why partnering with local organizations that assist vulnerable population is one method to achieve this. And speaking of methods, using community-based participatory research techniques, which involve local residents in every stage of the study process, is another way to guarantee inclusion.
There are several strengths and limitations to the approach that we have chosen for this community assessment. The focus on a certain group of individuals at greater risk for mental health problems and the emphasis placed on offering this group help and resources are the assessments, which are the main points of the strength, like the offering help and resources. These assessments may also be able to shed light on the particular mental health requirements of Canadian nurses during the COVID-19 pandemic, which will be helpful in developing programs and interventions that are more specifically tailored to their needs. The fact that our community assessment uses a variety of evidence resources, including scholarly studies and recommendations from reputable groups like the Registered Nurses Association of Ontario, will strengthen it. Canadian nurses' interventions can be influenced by the RNAO's advice on psychosocial support during the COVID-19 pandemic. This assessment also has limitations, such as the possible challenge of reaching all Canadian nurses and assuring that they receive the required support. There may be other categories of healthcare workers that are also at higher risk for health difficulties, and the assessment may not fully reflect the spectrum of mental health concerns which Canadian nurses are dealing with. The advocacies and ethical considerations. So advocates should push for allocation of enough resources to meet their demands, raise awareness of the difficulties experienced by the Canadian nurses, and emphasize the value of mental health support. The RNAO's guidelines on psychosocial support place a strong emphasis on the value of giving nurses and other healthcare professionals the tools and support they need to take care of their mental health. While creating treatments for Canadian nurses, it is also crucial to keep ethical issues in mind, such as making sure that the interventions are founded on research and appropriate for Canadian culture. Finally, e-learning can help nurses develop their assessment and abilities, knowledge that can result in improved patient care and lessen psychological discomfort. These are all the references that we've used in this research.
Thank you.
Thank you.
Thank you.
Thank you.